Have you noticed you just don't have the energy you used to? Maybe you're taking a pill every morning that's supposed to help you, but lately you feel worse than ever. Let me explain what might be going on. In the next few minutes, I'm going to share something that might surprise you. Something that could explain why you're feeling so tired, why your legs feel heavy, and why your get up and go got up and went. And I'll tell you what you can do about it. Let me tell you about a woman I know. Her name is Carol. She's 67. She loves gardening, loves her roses. A couple years ago, her doctor put her on a blood pressure medication. Nothing unusual. Her numbers were creeping up, and the doctor wanted to get ahead of it. For the first few months, everything seemed fine. But then Carol started noticing things. She used to spend hours in her garden. Now, after 30 minutes, she needed to sit down. Her legs would ache. She'd feel dizzy when she stood up from weeding. She told her daughter, "I guess I'm just slowing down." Her daughter thought maybe it was just age. Carol thought maybe it was just age. Even her doctor, when she mentioned it, said, "Your numbers look great. Keep doing what you're doing." But Carol knew something was off. She just couldn't figure out what. Here's what nobody explained to Carol. That little pill works by telling your kidneys to get rid of extra water. Less water in your body means less pressure in your pipes. Simple enough, right? But here's the thing. When your kidneys flush out all that water, they also flush out things your body needs to run. Think of it like making coffee. If you use too much water, you wash out all the good stuff. You end up with something weak that doesn't do the job. That's what's happening inside you. The pill is washing out minerals your muscles need. Your heart needs them. Your legs need them. Your brain needs them. And when those minerals get low, you feel it. You feel tired. You feel weak. You feel like you're running on empty. Have you ever stood up too fast and the whole room spins? Maybe you grab the counter to steady yourself. That happens when your body doesn't have enough fluid volume. The pill is keeping you on the dry side. And when you stand up quickly, your blood takes a second to catch up to your brain. It's scary when it happens, and it's easy to brush off. I just stood up too fast. But if it's happening a lot, it's a sign. Your body is telling you something. What about your legs? Do they feel heavy at the end of the day? Do you get cramps at night that wake you up? That's that mineral loss I mentioned. One mineral in particular. It's called potassium. You've heard of it. It's in bananas. It's what helps your muscles relax after they squeeze. When your potassium gets low, your muscles don't want to let go. They stay tight. That's the cramp. That's the ache. That's your legs feeling like lead. And here's the thing. Your heart is a muscle too, the biggest one. When it doesn't have enough potassium, it can get a little cranky. That fluttering feeling in your chest, that skip beat, sometimes that's just your heart saying, "Hey, I'm running low on fuel here." Now you might be thinking, "My doctor checks my blood. Wouldn't they see if something was low?" That's a good question. Let's talk about that. Section 4. What your blood work shows. Here's what most people don't realize. When your doctor runs your regular blood work, they're looking for big problems. They're checking your cholesterol, your blood sugar, your kidney function. But those mineral levels, potassium, magnesium, sometimes those aren't on the standard test. And even when they are, the normal range is wide. You can be on the low side of normal and still feel terrible. That's the gap. The numbers say you're fine, but your body says you're not. Let me explain the cycle people get stuck in. You start the pill. You feel okay at first. Then the fatigue hits. Your numbers are good, so nobody changes anything. You start feeling run down. You might eat more because you're tired. Or you might crave salty snacks because your body is losing salt. The salt makes you hold water. Your pressure creeps up. The doctor says, Let's increase your dose. You take more of the pill. You flush out more minerals. You feel even more tired. You eat more salty food. The pressure goes up again, round and round. Higher dose, more fatigue, more salt, higher pressure. It's a cycle that's hard to break when you don't know what's driving it. Section 6. What you can do tomorrow. Okay, so what do you actually do? Because I'm not telling you to stop your medication. That's dangerous. Your body has gotten used to that pill. Stopping suddenly can cause your pressure to spike, and that's a real risk. But you can start being a detective in your own life. Here's what I want you to do. For the next week, pay attention. When do you feel the most tired? Is it worse after you take your pill? Do you feel dizzy when you get up from the couch? Are your legs cramping at night? Just notice. Write it down if you need to. Become the expert on your own body. Then, next time you see your doctor, I want you to ask one simple question. Could this medication be affecting my energy levels? Can we check my potassium and magnesium? That's it. One question. It's not confrontational. It's not telling the doctor how to do their job. It's just you being curious about your own health. If your levels come back low, you've got answers. Maybe you need to eat more foods with those minerals. Maybe there's a different medication that works differently. Maybe you just need to pay more attention to staying hydrated with the right kind of fluids. Here's something a lot of people don't know. There are other blood pressure medications that work in different ways. Some of them don't flush out your minerals. Some of them don't make you tired. Some of them work more gently with your body instead of against it. If the one you're on is making you feel like half the person you used to be, you have options. You can say, "This one isn't working for me. Can we try something else?" That's not being difficult. That's being smart. That's being your own advocate. Here's what I really want you to understand. The goal isn't a number. The goal is you, your energy, your ability to do the things you love, your ability to play with your grandkids without needing to sit down, your ability to get through the day without feeling like you're dragging a weight behind you. If you're hitting the number but losing yourself in the process, something needs to change. Think about Carol for a minute, the woman with the roses. After months of feeling lousy, she finally asked the question. She went to her doctor and said, "I feel terrible. What's going on?" They ran some tests. Her potassium was low. Her magnesium was low. They adjusted her medication. She started eating a banana every morning, a handful of spinach in her salad. Nothing dramatic, just small changes. Within a few weeks, she felt like herself again. She could garden for 2 hours without needing a break. She stopped grabbing the counter when she stood up. She slept through the night without leg cramps waking her up. She wasn't just getting old, she was depleted. And once she fixed that, everything changed. If this story sounds familiar, if you've been feeling off and you couldn't figure out why, maybe it's time to ask your own questions. Your body knows when something isn't right. Don't ignore it. And if you found this helpful, hit that subscribe button. We talk about real health issues here, the kind that affect your everyday life, the kind that don't always show up on a standard test. I'll see you in the next video.